As people age, many fear a loss in cognitive ability or the onset of dementia. Dementia can take many forms. Vascular dementia is one such form. The pathophysiology, prevalence, demographics, risk factors, clinical presentation, and diagnosis of vascular dementia will be discussed in this presentation. According to the Alzheimer's Association, quote, vascular dementia is a decline in thinking skills caused by conditions that block or reduce blood flow to the brain, depriving brain cells of vital oxygen and nutrients, end quote. Vascular dementia commonly occurs after suffering a stroke or cerebrovascular accident. It can also be caused by atherosclerosis of the cerebral arteries. When the brain does not have adequate blood supply, cognitive ability is irreversibly impaired. Between 5 and 6 million people in the United States have some form of dementia. 10% of these dementias are solely vascular in nature. However, up to 50% of people with other dementias, such as Alzheimer's disease, also suffer from vascular dementia. Vascular dementia is the second most common form of dementia, preceded by Alzheimer's disease. Vascular dementia is most common among the geriatric population. 14% of people aged 71 and older have some form of dementia. Vascular dementia is more common in women than in men. Approximately 2/3 of people with dementia are women. Compared to Caucasian Americans, African Americans are twice as likely to suffer from dementia. Hispanics are 1.5 times as likely to suffer from this disease. There are several risk factors associated with vascular dementia. The greatest risk factor is age. Risk of developing dementia doubles every 5 years after age 65. Stroke victims are at a very high risk of developing vascular dementia. People with diabetes, hypertension, hyperlipidemia, cardiovascular disease, or history of head injuries are also at risk. There are several modifiable risk factors. These include smoking, diet, cholesterol levels, alcohol consumption, and activity level. The clinical presentation of vascular dementia is often not much different than Alzheimer's dementia. One major difference is the fact that vascular dementia can have a sudden onset after a person suffers a stroke. The signs and symptoms of this would be confusion, disorientation, and aphasia, which is difficulty with speaking or understanding speech. Other signs and symptoms of vascular dementia include impaired planning and judgment, uncontrolled laughing or crying, diminished attention span, personality or behavioral changes, memory impairment, apraxia, which is difficulty with motor activities, and agnosia, which is a failure to recognize sensory stimuli. Vascular dementia is oftentimes diagnosed in combination with Alzheimer's disease. The clinical presentation is extremely similar. Usually a diagnosis requires a patient to have impaired memory combined with one or several of the following: aphasia, apraxia, agnosia, or impaired executive function. Neuroimaging, such as a CT scan or an MRI, can confirm a diagnosis of vascular dementia. Recent history of stroke or multiple transient ischemic attacks is also an indicator. It is important that diagnosticians rule out delirium, brain tumor, subdural hematoma, or other neurological conditions that could cause a change in mental status. There are several diagnostic tools that can assist in making a diagnosis of vascular dementia. Because vascular dementia and other dementias often have similar presentations, these tools are useful for many types of dementia. One tool is the mini-cog test. For this test, the clinician speaks 3 words and asks the patient to remember them. The patient is then asked to draw a clock face reading 10 minutes past 11. After 3 minutes, the patient is asked to repeat the words. If all 3 words are remembered, the test is passed. If the patient remembers 0 words, the test is abnormal. If they remember 1 or 2 words, but draw the clock correctly, they pass the test. If the patient fails this test, a more in-depth test should be performed. Cognitive tests such as the Montreal Cognitive Assessment are more advanced tests. This particular test is scored with a maximum of 30 points. Anything less than 26 is an abnormal result. There are many different cognitive tests available. Some of them, such as this one, are free to access. If these relatively simple tests provide abnormal results, the patient may benefit from seeing a specialist. Consulting psychology, psychiatry, or neurology could be beneficial. In conclusion, vascular dementia is the second most common form of dementia that older adults face. Its presentation is similar to Alzheimer's disease, but it has different pathophysiology. Although age is a large risk factor, there are many modifiable risk factors. Clinicians can use several tools to help diagnose vascular dementia and help patients get the treatment they need.